Good morning to all. So today's e-content for today's topic is single-use endodontics. What is meant by endodontics? Whenever the caries which enter into the enamel and dentin, the patient doesn't have any complaint of pain. Only the patient have a sensitivity. So that time we can do the restorative procedure to save the tooth. Sometimes what will happen, it will enter into the pulp or nearing the pulp. That time the patient complains of pain, or whenever the patient consume hot or cold, that time the patient have a problem of pain and severe sensitivity. So that time when you check the vitality of the tooth, when you take a brief history, the patient have a indication for root canal treatment. So olden days, what we usually do, we call the patient in the first visit, we give a LA and do the access cavity preparation, remove the pulp tissue alone, and relieve the occlusion, then give a processing and send the patient. So this is the first day. When again we recall the patient after the week time. So the patient comes the second time, that time we have to do the biomechanical preparation. So when biomechanical preparation, what we usually do, we remove the debris from the canal, we clean the canal and we are shaping the canals. Okay. So why we have to shape the canal? To receive the restorative material. The restorative material is gutta-percha. Again, you have to recall the patient after given a processing. Again, so usually it takes 2 to 3 weeks time period. Sometimes the patient, what is the problem means, once you remove the pulp content or pulp tissue from the radicular portion, the patient doesn't have any kind of pain. So the patient won't turn back for completing the procedure. After a few years later, only the patient have a discolored tooth or huge swelling at the apical portion. That time it indicates root canal followed by periapical surgery. To avoid that, then advancement in the endodontic instruments. What are the endodontic instruments? Olden days we used a micromotor to do access cavity. Then they introduced aerotor with a speed of 3 lakh per RPM speed. So it automatically it will remove the debris, everything within a moment. Okay, once remove this, with the help of the pathfinder pipe, you locate the canal, or with the help of the GG, remove the shoulder and enlarge the orifice of the canal. So once you enlarge the orifice of the canal, after that you have to introduce that pathfinder pipe to check the patency of the canal. If the patency of the canal is fine, means you have to enlarge the orifice, find out, or the outline of the access cavity is determined by the shape of the pulp tissue or shape of the pulp chamber and number of the canals and number of the orifice. This is only determine the outline form of the access cavity preparation. Once everything is fine, then you have to use a magnifying glass, or that means loops or microscope. Under the microscope or loops only, you can find out the number of canals. In case sometimes what are the problems we will face? We'll face the problem of we're not able to negotiate the canal. Okay. So at that time, we have to use the DG16 or to use a EDTA to soften the dentin area. Then you have to negotiate or locate the canal with the help of DG16. Once you locate the canals, then you have to coronal enlargement. You have to do. This is the part of the single visit endodontics. Okay. So what are the indications for single visit endodontics? So patient have a severe pain, but the patient doesn't have any complaint of VP canals after the canal treatment. Is there any radiographic changes? Or if the changes is there, but there is no defect in the vestibule area of the tooth. If the sinus tract is present, but there is no coolant discharge to the canal, only that discoloration is there. That means that the tooth indicated root canal followed by non-vital bleaching. So these are the common indications. The patient does not able to come for longer period. Patient wants to complete the visit in a single visit. Okay, in case mentally challenged patient. Okay, so those are the patient we can finish it in a particular time. This is called single visit. All this procedure, locating the canal or access cavity preparation followed by biocardal preparation and the obturation. All together, we do it in a single visit. It's called single visit endodontics. So, single visit endodontic therapy is defined as the conservative non-surgical treatment of an endodontically involved. That means the pulpal involvement tooth consisting of complete the biomechanical cleaning and shaping and obturation of the root canal system in a single visit. It's called single visit endodontics. For that, we needed what other thing? We need a magnifying glass. We need a apex locator. We need a rotary instruments. So with the gadgets, we can finish it the root canal in a single visit. Within a stipulated time, we can complete the procedure. This is single visit. Okay. So what are the things? So what is the selection criteria? As I told, the patient should acceptance is there. Okay, sufficient time to complete the procedure. The physician or the dentist should be efficient to complete the procedure. In case any procedural errors, means we have to do it in 2 sittings. Okay, so this is the criteria for single visit endodontics. Okay, further we have to properly isolate and sealing sealing. Okay, then if really needed, we have to think about the uh, any aesthetic restoration, or if needed, we can give a crown for the patient. You recall, take an impression the same visit, recall the patient after a week, or given a crown. So then what are the main contraindications? As I told you, weeping canals. Okay. Then large periapical lesions, first discharge through the canal. These are the two, it's not indicated for single visit endodontics. Okay. The patient have a severe pain on percussion. Okay. So procedural difficulty. That means number of canals may be more or very limited mouth opening. The lesion is there, purulent discharge, then butterbus canal. So these are the cases we have to contraindicated. Means we have to take a time to complete the procedure. Okay. What is the advantages? So patient comfort is a main one. So economic. Why it's economic? Each and every time, no need to change the instruments. You no need to do sterilization each and every time. Then the Ramapuram also should not waste the time. Then number of visits by the patient also is less. Okay, restorative consideration, each and every time, no need to give a processing. So don't waste the material. Okay. Inter-appointment pain. So in case some of the patient won't come back, once the pain is reduced, the patient not continue the tablets also. So that kind of cases, immediately the patient have a severe pain. So that also we can avoid. Okay. Immediate aesthetic placement can be given in the anterior. That means we can give a pre-endodontic with the posterior or anterior aesthetic composite restoration in the anteriors. So what is the disadvantage? A single long appointment we needed. Sometimes the patient or a doctor will tired. Okay. Difficult to manage the flare-up cases. Already retreatment cases. We have to give a time to complete the procedures. Any hemorrhage or exudate, we have to do multiple visits. Okay. So a clinician should be that much efficient. Otherwise, don't do the single visit. So what is the main difference between single visit and multiple visit? Okay. So single visit based on the microorganisms. Large number of microorganisms are removed here. Here, if you want, we can give an intracanal medicaments to eliminate the bacteria or whatever the content. We allow the complete eradication of the thing in case any lesion is there. The metal of choice is calcium medicament. So each and every time I give a processing, then you recall the patient and complete the procedure in 2 to 3 visits. Then go for post-endodontic restoration. Okay. So as I told you, this is a discolored tooth. You can see. Okay. So these kind of cases you have to do single visit endodontics needed. Then you can go for non-visual bleaching. Okay. If the structure is broken, then you have to think about full crown. So success of the single visit is decided by the case selection, treatment procedures and protocols, time management, and sufficient duration of the recall appointments. Okay. So I hope everyone has understand what is root canal treatment do it in a single sitting. What is the advantages? What is the disadvantages? What is the indications? What are the contraindications? What is the procedure that are needed? What are the armamentarium we needed for single visit endodontics? Explain everything around it. Okay. Thank you so much to all of you.